I'm on a mission to free all of the people. I got a vision.
I think we'll do now is at 5 after 7 or 6. Turn it over to Madam President Rose Joshua of the National N.A.A.C.P. Chicago Southside branch. It's an honor for her to schedule to host this event. We're really excited about it, and we are forever grateful. Thank you.
Yes, thanks.
Good
Thank
evening.
you.
Good evening, everyone, and thank you for coming. I want to welcome you to the N.A.A.C.P, the National Association for the Advancement of Colored People, Chicago Southside. Yes, we are going to have a forum today, and this is a forum that is based upon passing a vaccine ordinance, of which we need. And I want you to listen to the panelists that we have tonight. They are wonderful panelists. And so my welcome is going to be very short. And right now I'm going to turn to the moderator of this event, Miss Joy Hunter.
Hi, everyone. Thanks so much for joining us. And I'm Joy Bunton, born and raised Chicago. And my mom is here with me, cheering me on. I'm a member of the N.A.A.C.P. Chicago Southside, as well as the People's Response Network to COVID. And last year, I organized the March for Medicare for All. So we're going to begin with Dr. Barbara Norman. She will set the foundation for the ordinance and present some slides. Thank you.
I'll start with unmuting myself, and I want to thank everybody again and give greetings on behalf of our family and my church, Liberty Baptist Church. And I also want to acknowledge my niece, Miss Tracy Daniels, who came on to also give me support and have a few words that I wanted to share on her behalf. One of the things I wanted to I know all of us have been grounded with this vaccine of COVID, the virus. And for those of us who are older, we know it's nothing new. However, what we do know is that it's so devastating. And I want to try to start a different way. I want you to take a few minutes and ask yourself, this time, November of 2019, January of 2020, can you remember, what were you doing? What were you doing? What were you wearing? Where were you going? And when you first heard the word COVID-19, take a few minutes. Anything come to anyone real abundantly?
I think I was terrified.
Oh,
You
when
know?
you first
Oh yeah, for sure. And we had to flip to remote almost immediately. So that was nerve-wracking and an anxious moment for me. But yeah, I think we were afraid because we didn't know what was happening. And of course I didn't trust the government. So there was a lot of fear at the beginning.
Where were you? You remember where you were at?
I think I was in the dining room. We were talking about this because we had to move quickly as a union to figure out what was going to happen to our employees. So, yeah, we were on the computer a lot back then too.
Anyone else?
I remember getting online immediately and starting to research for masks and PPEs, because as a medical social worker, I knew that we would need that. And it was, even in January, those things were hard to come by.
Right.
In November of 2019, my biggest fear was, what would happen for my father, who was at the time 94, 93 rather. And I was like, what is going to happen? But I had some faith in it because I had been trained as a medical social worker. So I knew what hospitals, well, at least I knew through Children's Memorial Hospital that we had been trained in the 80s for pandemics. So I assumed that hospitals would be gearing up as early as 2019.
Mm-hmm.
Turns
January
out
20.
that, yeah, turns out, no, in November 2019. And turns out I was wrong.
You're right. Mhm.
Everyone, this is Tracy Daniels again. Hi, everybody. Just really quickly, wanted to acknowledge two of Dr. Norman's other nieces from out of town are also on this call. Janice Barty and also Tony Williams. So wanted to acknowledge them. And then I also wanted to say hi to Tyrena Newkirk. She's a friend of my really good friend, Makisha Odin. So I see she's representing from the West Side. So
Wow.
hey.
Hi.
Hi, how are you? This time last week we were hanging out. So good to see you here. But one thing, really quickly, I remember about that time was I was working at Rush at the time in an administrative position. And one of the first cases I think came through Rush in like early January. So everyone was just very concerned. So to think back at that time, there was no vaccine and everyone was just very, very scared. So just wanted to share that.
Mm-hmm.
Okay.
Thank you. I appreciate that. And one reason I want to bring that up is because in November the 6th in 2019, those of you in public health, you know, the American Public Health Association has its annual conference, and I was in attendance, and it was in Philadelphia, and I was on a panel with several panelists and from the World Health Organization and the National Institute of Health and CDC, and there were several physicians talking about a cluster of client patients that were sharing similar symptoms. It had no name. However, they were saying that the number of clients they were received in the emergency room were either family members or were all working at the same place. That was in November 6 or 7 of 2019. After the conference, and then in December, I was at another panel when the patient there became very ill, high temperature, and of course we usually think of the flu or not. Well, we didn't know what COVID-19 was. So by January of 2020, as you may recall, was when the time when the first outbreak or patients that were coming in with Howard can help me on this as well, who were admitted into Chicago, and that may be the case, Tracy, you're referring to. It was the same. Was it Northwestern Hospital where the first patient was admitted out of Chicago, and that particular patient was treated, recovered, and was discharged. However, in January the 7th, when we look back at the data, it shows that the World Health Organization identified in China that the large number of clients that were being admitted. Therefore, they quarantined immediately. They warded out the communities. They mandated that people stayed at home. They took immediate control of this unknown virus that they thought was uncharacteristic of pneumonia. As a result of that, many of their clients were curtailed. The chances of progress was better, or I should say improved, more so than we did here. Then it was in January the 30th, roundabout January the 30th, the World Health Organization declared COVID as an emergency pandemic. I can go through the different cases of that. However, it was on January the 15th in the United States that we had the first case that was diagnosed with the chief complaints was respiratory distress. That was before a name was given to it. Roundabout in January the 18th, the first reported case. Oh, the slides. Joshua.
Yeah, let me do the slides for you. You're like 2 slides in. Sorry about that.
Okay, I just thought about that. And then I'm kind of going through it anyway, and we can make copies of this available. But the dates, the reason I'm sharing these dates, because it was January the 15th, January the 18th, March 16th, March 23rd, 2020. We are just almost 2 years to the date that the first patients were being admitted into the United States when the first case was identified. And go over one more, honey. Go over one more. And then we have, there we go, January the 15th. First case confirmed in the United States. He was 35-year-old gentleman out of Washington had just returned from China on that date with chief complaints was respiratory distress. January the 18th, 2020, little more than 2 years ago, the first case in Chicago. A young lady had traveled to Wuhan, was returned on the 13th. Her husband even contracted the virus from her. They both was treated at St. Alexis Medical Center, and they both made full recoveries. However, in March 16th, 2020, the first case that was probable case that was confirmed was believed to be that of Patricia Friesen. She was a retired African-American nurse here out of Chicago, and they recorded her death as March 16th. Somebody mute your mic.
Yeah, Joey, can you please remind people to mute if they're not speaking? Thank you.
Then at March 23rd, almost 2 years to the date that the ordinance was submitted to Chicago City Council for review to be addressed and approved. At that time, in less than 2 or 3 months, we had close to 600 cases of COVID-19 here in Chicago alone, where over 1,285 of those cases were identified in Illinois. Next, please. And then when you think about it, so I'm gonna move all the way up from March, April, May of 2020, and the impetus for the ordinance. We as a group, meaning the representatives from the PRN, members from the N.A.A.C.P, members from the Chicago Chapter National Black Nurse Association, representative from the Chicago Chapter Public Health, through various conversations, we began to pull material together. And it was clear to notice that within less than 6, 7, 8 months already, Chicago, the Illinois had over 188,000 cases alone. Cook County had already reported 44,000 cases. Chicago had 62,000 cases that were reported with close to 2,783 deaths. Those are the ones that's reported. The records show there were more deaths than that, but those are the deaths that were recorded. The CDC reported at that time, nearly 80 seconds, someone was dying from this virus. You remember around about February, March of was it last year? No, 20. Remember when the mayor set up the makeshift hospital beds over in McCormick Place? Remember when she brought in the number of cubicles because patients were being admitted so rapidly? That was at the same time when we were experiencing the number of deaths. Next, please. Then you'll see it was for those of you who are on the line who are not familiar with Chicago, Chicago is divided into like 77 community areas. They're supposed to be equally distributed among the various population groups. And naturally, if you look at the way people are segregated in the city of Chicago, those communities that have the highest risk, the highest mortality, and the highest number of deaths tend to be concentrated in several of the Pacific community areas. Now, according to our mortality morbidity data, it's usually divided into community areas and zip codes. And when you try to look at your area and try to identify the number of cases, it becomes somewhat difficult, especially when you think about our wards. So when you think about community areas, Chicago has 77 community areas. We have over 60-something different zip codes. But what is important is the fact that the city of Chicago is divided into wards. We have 50 wards that are divided into the various community areas, and many of them cross over each other. Therefore, when you identify a problem and trying to identify the Pacific alderman that's assigned to that ward, he or she may say, that's not in my area. So if you look at this map, which is difficult to see, but kind of give you just a little boundary, then what these categories are showing is that each of those numbers, a little numbers right there, represent a community area. I can't even see this one. Let's just say, do you know your community area, Howard?
Yes, I do. It's community area number 30, South Lawndale.
Yes, the community area is 30. The community area name is South Lawndale. Now, the alderman person, how many aldermen do you have in that area?
We have 4 aldermen due to gerrymandering.
They're gerrymandered. So for those of you who are not familiar, get an idea what made us start discussing this issue about the disparity in the number of deaths in our various community, because it was hard to identify a specific alderman that we could address take our problems to. If you show the next slide, what we did, this is based upon the impetus for the ordinance. This is Chicago COVID-19 cases by community areas, like Lawndale, the zip code, and the ward. So if you look at the legend here, this data was compiled back in July of 2020, when we noticed a disparity in the number of patients who were dying in predominantly Black and brown communities. And as a result, the data is reported in zip codes. So if you look at the left-hand side of your column, you'll see the different zip code, 20, 21, 23, 26. However, that didn't tell me anything. So then when I look at the number of deaths by community area, they say, oh, it was 71, 68, 20. That didn't tell me anything. So then when you start looking at the name of the different areas, well, it kind of start putting things in perspective. However, when you start going down and looking at the number of total patients that's been confirmed and the number of cases of the death rate, look down the column here, like 44. Here over in Austin, I'm just using this here. Austin, you have 13,000. Rogers Park, 18,000 of the number of cases reported, 19,000. So then when you start looking at the ward in and of itself, now we can identify a name to the ward that we're trying to get some information from. Now we're able to say, look, we have these different alderpersons. These are the individuals that we need to address in order to bring the programs and services into their community to reduce the gap in the number of deaths associated between Black, brown, and white communities. And then we go over one more. Let me see, we got the ward, you got the community area. Okay, now this is the one where, now this is what brought us to developing the ordinance. Well, my background is in public health. And by the time we was working on this ordinance in July, August, September, in 2020, we went from 7,000 now, it's on like 3 or 4 months. We have now lost over 12,000 neighbors in our area related directly or indirectly to COVID-19 illnesses. Now, this doesn't even include the number of patients that's been discharged who were diagnosed with the virus. It doesn't even include the ones that have been in the hospital over a longer period of time. These are just the numbers that we're using that are recorded in the books. This doesn't take into all the disparities and problems they're going through. And even if we go through the number of deaths, those that's hospitalized, those are hospitalized at a longer rate. And we look at the availability and accessibility of the resources in our community, we also found they were depleted. As a result of that, that's when we sat down with several of our members and developed this, our ordinance. And if you notice that the title of the presentation has to do with, originally we was calling it, take the vaccine. We call it, like in the military, you know, we had it like a boot camp where you would take the brigades into the community in order to identify families who are willing and ready to be tested, so we could do contact tracing, to be able to test those individuals and then offer vaccine. Vaccines were not available then, they hadn't been developed. They didn't really become implemented until December, late of 2020. So that's where we're at now. I will probably go in detail about the ordinance, but basically what it's saying, look, we wrote this ordinance for the city. It was introduced by one of our prominent alderperson who went out on the ledge and said, look, we had to do something for our people in our community. As I mentioned, there's 50 aldermen, of those 50 aldermen, probably 22 to 24 are in high-risk community. Of those 22, 24, probably 18 specifically, and definitely 15 have some of the highest death rate, illness rate, low vaccination rate, high violence rate, crime, at every indicator are in those particular areas. Therefore, you would think those aldermen and representing their community will be a priority, have this ordinance as a priority on their list to provide services. And what the ordinance does is that it establishes community brigades where individual, you have a nurse, you have a staff person, and you have a tech, and you have a recorder, will be as a team that will go into the community and will do the testing, do the screening, the testing, and immunization as needed. And we will do that according to the high-risk community areas, mobilize, move out, and then take the next community group. Of course, the goal is to make sure that everyone is vaccinated, even though those who choose to be, and this will increase the immunization rate, decrease the illness and symptoms, and hopefully promote the quality of life. I'm going to detail after I let Dr. Ehrman start his presentation, because then Christine is going to speak also. I can relate specifically to the elder, the middle age group. Christine has a lot with the school system. And of course, Howard has a global perspective for all the categories. I will be available for, I'm still on. If you have any questions, you can put in the chat. I can look ahead of time, so when you get ready for any question and answers, I will be ready. With that, I know my little 10 minutes is, oh my goodness, gone. Dr. Howard, I'm gonna turn it over to you. Thank you, Dr. Estrada.
My pleasure, anytime.
My little sister.
Thank you so much, Dr. Norman. My name is Dr. Howard Ehrman. I'm a pretty much lifelong Southsider. Most of my life. I'm going to be 75 in a couple months, and grew up on the South Side. I'm the former Assistant Health Commissioner working directly with Dr. Norman under Mayor Harold Washington. I was a faculty member at the University of Illinois at Chicago for over 30 years, and also at Cook County Hospital for about 35 years, among other things. I always like to tell stories, so I'm going to tell my story of why one of the reasons I'm here. I was 5 years old in 1952, living on the South Side. Most of my generation family members worked either in the steel mills, Southworks, or in my father's case, he worked at Ford Torrance, which is now the largest automobile factory in the United States on the South Side of Chicago. He was a member of the United Auto Workers. They went on strike in 1952, and a couple of days later, when we had no health insurance, I woke up one morning paralyzed from the waist down with polio. I'm one of the lucky ones to not only have survived that, but it took me about 6 to 9 months to learn how to walk. I was supposed to start kindergarten long after I was infectious and I wasn't contagious to anybody. My parents rolled me up to O'Keefe Elementary School in South Shore to go to school in a wheelchair, and they refused to let me in because people were terrified of polio. This was 3 years before the vaccine was actually out in the public. That year, 1952, were the greatest number of polio deaths in the United States, 42,000. 42,000. The United States had that many deaths in a couple of days in the last 3 months. So the perspective I have is based on that and based on the necessity of basically reimagining, rebuilding, and expanding our health department. So I'm going to show you a few slides here. Let's see. There we go. Let me find PowerPoint. Here we go. So this is who most of, or many of us are here, and I really want to thank Rose Joshua, who I had the pleasure of meeting about 12 years ago, working together with the N.A.A.C.P locally and nationally on environmental justice. One of the great victories of that working together was closing the two largest coal power plants in the United States here on the southwest side of Chicago in Pilsen and Little Village. So thank you, Rose, and everyone else. Barbara, who is part of one of the most important historic organizations in our country. So this is who we are. And I'm going to start with one of the most important people victories in my lifetime, certainly in the last generation. Where two close friends took on the second largest company in the United States, Amazon, and last Friday won a union that they literally built from the grassroots. This is not part of a bigger union. Christopher Smalls is the person in the middle. And how did this whole struggle start? Chris went to work in February and March in Amazon. Sometimes he was a supervisor, sometimes he wasn't, and he noticed all these sick people that he knew. He went to his supervisor, then he went to the manager of this huge Amazon warehouse on Staten Island and asked what was going on. Then he realized, that people were getting COVID. So he brought people PPE. He asked Amazon to give them masks. He asked people to socially distance, and for that he was fired. So this is the result 2 years later. A tremendous victory. And the thing that is so important about this victory is the people who actually are most affected, the workers themselves, built this union from the ground up. If they can defeat Amazon, we can pass this ordinance with the mayor of the city of Chicago. This is a few things about the ordinance itself. It would immediately create 2,500 jobs using just a fraction of the federal money that the city of Chicago Department of Health has gotten. The city has gotten $614 million in the last 2 years just from the U.S. Centers for Disease Control. It's gotten hundreds of millions of dollars more just for the Department of Health from other federal funding. These jobs would be at least $20 an hour. They would be for people first and foremost from those communities most affected on the south, southwest, and west side. Most jobs would be in the Department of Health, but some of them, over 200, would be community health workers in community-based organizations within each one of the communities, and also hundreds of new jobs for federally qualified health center who take care of about 30 million people in the United States, including tens of thousands here in Chicago. It would create, as Barbara mentioned, 3 types of brigades: community brigades who would go door to door. They would work with local churches and other religious institutions to basically have people not just get vaccines, but to get tests, which are actually have been much harder to get since the beginning of COVID than vaccines when they became available. They would do contact tracing through one centralized organization, the Chicago Department of Public Health, which is the way it always was throughout the United States until the Trump and Biden administration, until the governor of Illinois and the mayor of Chicago privatized contact tracing into little bits and pieces, which was a complete failure and led to many, many more thousands of people getting sick and dying. They would be vaccinators. Actually, it's maybe hard to understand or believe, but Illinois and Chicago allows lay people to become vaccinators. There is actually a group of lay vaccinators who for 25 years have gotten vaccine from the Chicago Department of Health to go out and provide hepatitis B and other types of vaccine to people who are homeless and other people on the streets of Chicago. It would provide resources badly needed since things have gotten worse, not just health-wise, but economic-wise for the vast majority of people in Chicago. Let me move on. Actually, let me do, yeah. So the key basically to public health and the difference between public health, the way it should be practiced, the way it was under Mayor Washington and for many, many years, is you have to go out to the people. You don't force the people to go to a medical facility in order to get treated. You go out to the people. We would still be living with thousands and thousands of people dying of HIV if we made everybody come to a facility. We established teams of people who went out onto the streets, who went and are still going as of today into clubs, into houses, into shooting galleries, meaning shooting up IV drugs, et cetera, to give out condoms, to give out medication, et cetera, et cetera. That's what should have been done with COVID. Basically, the way that it was done for 150 years in every city in the United States was people led by public health nurses, who usually had at least 4 people working with them from those communities, would go out and they would test people. They would contact trace people with epidemiologists and other people. They would give vaccines, not by having people make an appointment online, not by having people call a phone number for the city and waiting 2 hours to talk to somebody. That's not the way you manage vaccines anytime, but particularly in a pandemic. You have to basically just go to where people already are congregating, where they feel comfortable, whether that's in their own home, in their own church, and certainly in schools, where I would say all of us 50 years or older here got some or most of our vaccines from school nurses or public health nurses. This is no surprise to anybody, I think, probably on this call, but if you look at a map right now of the United States, of where pharmacies are located, hospitals are located, clinics are located, and particularly, this is really important, drive-through pharmacies and pharmacy with clinics. CVS has one pharmacy with a nurse practitioner on the south side of Chicago, where people theoretically could go to do what's this new program called Test to Treat, meaning if you walk up there and your test is positive for COVID, you can get treatment immediately. One pharmacy on the south side of Chicago and the west side of Chicago. Walgreens has about 3 or 4. If you look at the north side, there's more than a dozen. So I know this is not a surprise, but this is the model that Biden in particular has pushed, who has gotten up in front of people along with our governor, along with our mayor, and said, go to your pediatrician, where most people don't have a pediatrician who most need it. Why is this a problem now? This is the data from an hour ago. New York City's transmission rate is 4 times higher than a month ago. Chicago's is 2 times higher. Only 29% of US residents have boosters. Less than a third of CPS students are vaccinated, 5 to 11, and less than a half of CPS students are vaccinated, 12 to 18. There have been many articles in the Sun-Times, in Block Club Chicago and Chalk Beat Chicago, which I would encourage everybody to read, that basically is proven with WTTW and WBEZ. There are 50 schools, all of whom are predominantly African-American, where less than 10% of the kids are vaccinated. The government has created the myth since Christmas that COVID is over. This is directed specifically from the White House by the Democratic National Committee. As you've heard in the last 24 hours, many members of the cabinet, including the Secretary of State, went to a big super spreader party on Saturday night in Washington, D.C. And guess what? They all have COVID now. So COVID is not over. And this is a map of how we've always tried to manage an outbreak, an epidemic, or a pandemic. A pandemic means like an epidemic, but it's on at least 2 continents or more. This is a map from 5 weeks ago. And you can see that most of the counties in the United States, including Illinois, are either red or orange. Those are the 2 worst categories, very dangerous. And this is a map that the CDC made up for the first time in history of not counting infections, only counting hospitalizations and deaths. Looks a lot better, doesn't it? That's not the way you manage anything in the question of infectious communicable diseases. The first thing you look at is transmission. Everybody here in this audience knows that poor people, working class people, particularly African-American and Latino Native Americans, are far less likely to have health insurance, far less likely to call an ambulance, far more likely to die at home and be misdiagnosed, not just with COVID and everything else. But even if everybody had Medicare for all, as Joy's been fighting for and other people, the fact of the matter is, if you start with the hospital, that's too late. We want to try to manage and prevent this from getting to the point of hospitalizing lots of people. This is just some data we don't need to go into about how you calculate this. It's not really hard. And the last thing I want to just say is the other part of the propaganda is the CDC purposely, right after Christmas, defined fully vaccinated is not, I want to say that again, not including boosters. But boosters give you 3 to 4 times more protection against hospitalization and death than if you just have 2 shots. We don't know the data yet of the new 4th booster, which I highly recommend everybody here 50 and older get, and also people who are immunocompromised under 50. I got mine the second day it was available last week. So I'm not asking you to do something I don't believe in. Lastly, what happened 2 weeks ago? The President of the United States gets up in front of a national press conference and shocks the heck out of everybody and says, guess what? We have no more money. We have no more money for the 30 million people that are uninsured in the United States, 280,000 people. Of course, that's an undercount in Chicago. No more free COVID tests, no more vaccine, no more treatment. And that's still the case. So that's the situation. There's other things to show. I'm only going to show basically here's the percentage of the US population boosted as of 10 days ago. It's probably 30% now, but it's not much more. That means we're in big trouble if we do get a surge. It's too early to say we are going to get a surge, but it's not too early to say that infections are going up. This is how we compare to Western Europe, who just had a huge spike in hospitalization and deaths. You can see the US booster rate is mostly a half or a third of what those countries are. And this is what happened to their hospitalization and death rate. Lastly, I would really encourage people to read this article from March 28th about the racial disparities in Chicago neighborhoods regarding CPS kids being vaccinated. Again, it's not going to surprise anybody. And you have to ask yourself, why did that happen? And the reason it happened is because, and this is true of almost every administration in the country, not just Mayor Lightfoot, they did not go to school and have enough nurses and use the $2.6 billion that CPS got to hire enough nurses to vaccinate kids where they go to school. They make their parents come, get them, miss work, maybe get fired to take them to a place, some other place to get vaccinated. That is not the way to manage this pandemic, and this ordinance would really, really solve that problem. Thank you.
Okay, thanks, Howard. Next, we'll go to Chris LaRhue. A special note is that Chris's dad and my dad used to be best friends. And some basic information is she's a retired medical community social worker who specialized in school social work with multi-ethnic families, especially Black, Latino, and biracial multicultural family systems. She worked in community social work doing child abuse and senior abuse investigations for over 30 years and in Chicago public schools for 19 years. She worked closely with school nurses in a combined effort to do outreach to families for networking for services regarding trauma, counseling, and recreation. She also was her family's designated caregiver to her parents, one who died of melanoma in early 2004, and the other in the first COVID-19 pandemic wave that hit the Southside of Chicago in 2020. She speaks to the need that intersects schools and Black and Brown communities. Chris LaRhue.
Chris, you're muted.
Yeah, there we go. All right. New to this stuff. What can I say? Yes, I am a retired school social, community social worker, trained as a medical social worker. Unfortunately, in the 80s, very few hospitals were willing to let Black social workers in to work to treat their own populations. So I have worked primarily as a kind of an intersect between community needs and crises going on with families regarding child abuse and elder abuse. And so I worked with Chicago Public Schools as a community resource person for close to 19 years, really. And I worked in particular schools in the Rogers Park area for almost 15 years. One of the things that I think that many people do not understand is, in regards to Chicago Public Schools, very few Chicago Public Schools have a dedicated nurse and a dedicated social worker to work primarily with that population. It's not unusual that a school nurse might have anywhere from 3 schools, sometimes 4, that they have to cycle through every week or every 2 weeks in order to serve that population. Same thing with a school social worker. School social workers primarily are there to work with children who have individualized educational plans. that require counseling, require networking, on school properties. So they are allotted to a certain amount of minutes that they must do per an IEP contract every week in order to meet the federal mandates that are put on for individualized educational plans. So what happens often is that if you have a crisis that occurs, of which we have been wrapped in for the last 3 years now, if you have a crisis where suddenly you find a child or children or a classroom that has, walked into, COVID-19 outbreak, there are not designated people who can actually go about and handle that, because that takes them away from the slotted minutes that they're supposed to spend with that particular population. So basically what you have is the resource people that you do have, they do not have allegiance to just one particular school and knows that school body very well. And two, they are locked into contracts that require specific minutes spent, with each child. The issue is that what I've been hearing from friends who are in the board now is that there is no contact tracing. It might be a secretary, or someone, or maybe a substitute who's handling that for the day, but there isn't anyone that's actually doing the face-to-face ongoing contacts to really pull in that kind of network. So, I mean, even 15 years ago, CPS didn't do very well with handling truancy. I'm in my 60s, and when you were truant, when you in the 50s and 60s, someone came to your house and knocked on your door and wandered around the community to find out where were these children who were not in the school. So that kind of totally went by the wayside easily 15, 20 years ago. So if the Board of Ed can't handle truancy, you can imagine trying to handle contact tracing is out the window as well. The other issue is parents do not have access to the kinds of medical resources that they would have compared to the North Side, particularly in Black and brown communities here in the South and West Sides. They don't have those resources where they can take off and go and get their child a shot or deal with medical needs, because their jobs, being essential workers, do not have that kind of latitude. If you take off, even if you take off early and you have to go pick your child up, you may run the risk of being fired. It's just simple as that. So also in the city of Chicago, on the North Side, in terms of public health clinics, last I checked, there were 6 clinics on the North Side. There were only 2 on the South Side, 2. And there's supposedly 1 mental health clinic on the South Side, but last I heard, they are not contracted by the city to be able to handle families. They only handle those people who are coming out of prisons. That tells you what kind of resources we have. The other thing is in regards to being able to handle the load that, say, the schools can't handle in terms of getting vaccines to people. Everyone has said, oh, well, hey, Walgreens can take it. As Howard pointed out, there's one CVS drugstore that has a nurse practitioner on the South Side is able to do that. Last I heard through Community Block Club, that CVS is in the process of closing that facility. Okay. Walgreens, even though there are not as many on the South Side, they are not equipped to handle the load of people who do want to come in to get vaccine. When I got my last booster, I didn't go to the one that's near my house on 87th and Cottage because it's been inundated. You could not get an appointment. I went all the way out to Orland Park, got the first date to get my booster, first one in line to get the booster. Was supposed to be there at 2 o'clock in the afternoon. No, 11 o'clock in the morning. Got there at 11 o'clock. It was so inundated that I did not get my booster until 5 o'clock. So that lets you know, even out in Podunk, Orland Park, that the Walgreens out there can't handle the load. So you can imagine here in Chicago, you can't handle the load. So the main issue is that parents in Black and brown communities do not have access to getting those things done regarding the health of their children. They didn't have the access years ago. So pushed into a pandemic, we have even less resources than that. Okay. And I remember one of our local Walgreens that was here on State Street, that was closed about 2 years ago after the riots and things that occurred. So we just do not have those resources. CPS does not supply school nurses and extra personnel to handle the load of even doing basic necessities regarding handling children who have asthma, handling children who have diabetes, handling children who have autoimmune diseases that need special care. And when a nurse has to cycle through 3 or 4 schools, let me tell you, that's like that movie that was out, if it's Tuesday, it must be Belgium. Where am I? This is what happens to a lot of personnel. Now, I was contracted as an outside vendor to work in a school primarily to fit that need when things popped in the school and you needed someone to go to this classroom, go to that family's house, who's going to do that kind of work. And those kinds of programs were cut in 2012 because the board was trying to supposedly save teachers' jobs. So even whatever vendors that they had to come in and do those kinds of emergency work, contact tracing, networking with parents, finding out what kinds of things parents could do in order to supplant the needs for a school. Those positions were cut in 2012. They have not been replaced. So when you have a social worker and a nurse whose job is to cycle through anywhere from 3 to 4 schools per week, what kind of medical care and counseling care do you think your child is going to get? So ordinances like what we need to put in the money and the personnel to handle these kinds of situations. Because like Howard, I grew up where I got my polio vaccine in school. And I remember what it's like at the age of 2 to be in a hospital with double pneumonia and seeing a ward filled with 25 iron lungs. And you are fearful that anybody who goes in that room will not come out alive. That's what I remember. And it hasn't changed. So we need these resources because the medical systems just are not there to handle the needs on the South Side, West Side, and the Pilsen area. These are the things that we need. So this ordinance is very important to develop a cadre of people, social workers, nurses, parents who can also help to do the contract tracing if they are, paid to be able to do that. We have families who want to do this. And this is how you build communities, is you make use of the people in the community, you pay them for their resources, and the community members can tell you what the community needs. So that's all I got to say. And, hopefully the city will do more in terms of helping families dealing with the trauma that goes along with COVID, COVID deaths. Considering 70% of the deaths in Chicago have been of African Americans, particularly who were seniors and middle-aged adults, we have lost the core parts of our families. This is why we have so many teenagers running around doing so much crazy stuff. We have people who are operating on trauma after trauma after trauma. And we're acting like, oh, we can take our mask off and ain't nothing going to happen. We have decades of research that says that's not true.
That's right. All right.
Thanks so much, Chris.
Thank you. Yeah.
Okay. Howard had requested that he show on the screen the testing and back sites. So Howard, you can go.
Yeah, thank you. So
quick.
I think probably people may have heard, there's so many things that have happened. 4 years ago next month, There was a major published study done by New York University of about 15 cities in the United States. And I'm sure to no one's surprise here, the city with the greatest life expectancy gap was Chicago, literally 30 years between people who live on the Gold Coast and people who live in Englewood. Now we are 4 years later, and our tax money paid for the best screening test in the world for COVID. It's called the Shield test. You may have heard of this. Instead of having to have a probe put up your nose, which a lot of people don't want, you just have to dribble or spit into a little cup. And there are 30, it's a great advance for science and potentially a great advance to help us manage, control, and save lives. That's what this is all about. It's literally about saving lives. So these little blue dots are where the 30 or 31 sites are in the state of Illinois. And 2 of these blue dots are in a black or brown zip code, the ones in East St. Louis, one of which is a site of the Madison County N.A.A.C.P. In Chicago, there's not one site in a black or brown neighborhood. The only sites that exist are downtown at the Dirksen Courthouse, DePaul University, and Northeastern University. So that's the first slide. Let me just show quickly 2 more. This is the city of Chicago community-based testing. You can see the label is pretty clear here. And let's see, where are we here? Yeah, right here. So here's the city of Chicago community-based testing. Not one of them is in or close to an African-American neighborhood. So it's got the Shield sites. It's got only 1 city college instead of all 7. It's got a program called Connect Chicago, which only exists, I couldn't believe it, in my neighborhood, a little village. By the way, North Lawndale Little Village is zip code 60623. We have the most deaths in the state of Illinois from COVID, 325. So that's the situation for testing. Now, what about getting a shot? Is that going to be better? Well, here's the situation with getting a shot. Let me just go to that screen, and this is the last one. And again, this is the city of Chicago. You can read it yourself. It's live right now. City of Chicago testing sites. And I'm going to ask my big sister Barbara to comment on this, because when she and I were working with other people under Mayor Washington, we made sure that all these things were by far equitable by race and class. Now, here's the situation. Again, one place operates in only 1 of the 7 city colleges. Arturo Velasquez is actually part of Daly. It's about a half a mile from me. It's right in the middle of the city, but doesn't mean it's easy to get to. And you can see that's a privatized site in a city college. And then there's 2 standing clinics that actually have been existing before COVID, but none of those one's on the north side and one's on the far southwest side. You know, and then basically you've got school-based clinics. Some of those are in African-American neighborhoods, but again, it's difficult for parents to get there and families, because you can see what the hours are. Is anybody working Tuesday, Wednesday, Thursday, or Friday from 9 to 1? Please raise your hand. So I think it's pretty self-explanatory here.
Yeah.
Yes.
I did want to say to respond to what Dr. Howard was saying. You know, one of the difference, major difference, I would think, under Mayor Washington's leadership, his whole philosophy for public health was much different. He had public health as a priority. We were at the level of the fire department, police department, the parks, and we had over close to a $90 million operating budget. We had 12 maternal and child health clinics, 19 community mental health centers. We had 6 neighborhood health centers. I had, I could go on and on, 4 alternative clinics. We had public educators. We had TB clinics, STD clinics. We had the WIC program. Those of you may remember the health educator promoters. And right now, in one of the objectives with under his structure was that people from the community were recruited and trained and return in their community to do health education, to help to assist with transportation, to help with screening. Right now, we had over 352 public health nurses. Right now, the public health department, I don't believe we have 35. There's no way we have maybe one or two public health educators. There's no way. It is criminal that and remember, the public health department is governed by the state legislature to provide program and services to these people. I want to also acknowledge, I just see I have 3 nieces from Kansas City. I have another niece that's here. I have a couple of our students who are graduates on all in healthcare. So I'm recruiting you guys now after this meeting so that we can get you involved with the some of the activity. We need you. And in order to address this problem, and it can be done. It can be done. And I think one of the ways, and I didn't want to go into this, but being in Chicago, Chicago is very political. You cannot talk about healthcare. We don't talk about politics. You can't talk about community. You cannot talk about equal access. You cannot talk about availability if you're not going to talk about politics. Each ward, each 50 ward, as I mentioned earlier, I told you as they're divided based upon community population, each alderman person is giving community development, I don't know, they call it community development block grants anymore, but they're giving funding for each ward. If you wonder why your ward is not looking like some of the wards up north, ask your alderperson. The amount of dollars that are distributed to each community is to assist the residents into securing the programs and services they need. If they're not providing, why do we keep them? I want to thank Jennifer Liddell this zone. I see there's things that we can do, as you're talking about the 2 young men, Howard, who took action and took down the Goliath. It can be done. You had to be committed, just like those individuals who sat around 2 years ago who was writing that ordinance. Out of that group, 7 have already passed away. Either them or their friends or their family members have died from COVID. And we're still sitting here 2 years almost to the date that ordinance is sitting there on someone's desk, refused to be signed off and supported to help the people. That's insane. And the people, I looked at the name on the participants, we're talking to the choir. We need to get those who don't know the song to help them to learn the lyrics and to know what to do to pick up the banner. And I know we have some questions, and I'm gonna turn it back over to our moderator and the president and Jesu and ready for a question. Christine, I see your hand up.
Yes. One of the things that we have to look at politically and to raise the question of why is the South Side and West Side being ignored by the city politicians? I remember in January of 2020 when the vaccines came out, and Chatham, of which I live in, has roughly about 45,000 people. The city sent 1,200 vaccines to Chatham. Yeah. That was it. I mean, that's not even a drop in the bucket. And when you think of the number of people that come down the expressway on the L's who are essential workers, what happens if those essential workers are wiped out? Who's going to do those jobs? So economically, it would benefit the city to make sure that these areas that they ignore to be followed through on with the finances and the resources that we need. Okay. And I mean, it's just simple mechanics like that. So, 1,500 vaccines for a population of 45,000 people.
Dang.
That didn't make no sense.
Disgraceful.
Can I say something? I want to piggyback off of what she was saying about the vaccine. Can you hear me?
Yes.
Oh, okay. The vaccine didn't come out to 21 of January. It got approval last of December. Trump, who was our president then, only ordered, I don't know if everybody know that, but 100 million dosage of vaccines when we have like 346 million people.
Yeah.
So you have to get 2 of those dosage. That's what, and they was, I was surprised we got that because I was waiting for one too. That's why I'm saying I was doing my own investigation. But that is what happened to the vaccine. And I was qualified to get a dose earlier and couldn't get a dose. I had to stand in line. Well, I didn't stand in line, but I tried until Biden got in office January the 20th. He had to reorder more vaccine after he got approval from the rescue plan. He passed the rescue plan when he got in office. And that's how vaccines started flowing into the communities. Our prior president didn't order enough for the American people. So they were like just giving every community or city some vaccine because they had to give it to the United States, 100 million dosage. So we all was robbed. That's what I wanted to say.
Yeah. Yeah, you're right. You're right.
And the Black and brown community, of course, suffered the most. If the other communities get it, you better believe we suffered the most.
That's true. That's definitely true.
Well, the rich people got it first. I should say that.
Yeah.
Well, my favorite memory of trying to get my first COVID vaccine was going through the city's website of getting an appointment and finding and getting a little notice across my phone that said you are in an electronic waiting room with 50,000 people. And I sat in that waiting room for 2.5 hours and finally gave up. And then on the news, they reported that same day, oh, you were in an electronic waiting room with 50,000 people. It was actually 75,000 people. And I said, what mental numbnut in city government actually organized this? I mean, it was just, the response was, even when we got the vaccines, the response was so pathetic. It really was.
Okay, did we have any other questions, or I can start things off with a question?
I do have a question.
Sure,
This
okay,
is
great.
Marina. Hi, I just wanted to, just in terms of thinking about action steps and just how my personal opinion is that people in my generation in the Black community just have a general sense of apathy when it comes to some of these issues, not just health related issues, but political issues. And with the vaccine being so politicized, I think people have just kind of disengaged. And I'm just curious, like, how can we, or if there are any ideas on how we can just mobilize more people for the cause? Like, I think the same players are in these rooms, and we need people outside of those of us who are very passionate about this to start taking some action. And just everyone's so apathetic to some of this stuff. And I just don't know if you guys have any ideas on how we can maybe shift that a little bit for especially people in my generation, millennials. I feel like we are completely disengaged from what's going on.
Right.
Well, this is a problem with millennials because most of my cousins are millennials, and they basically have the viewpoint because they don't have the underpinning of understanding how a lot of government works or doesn't work. And they basically, my cousins would basically say, well, why should I even pay any attention to this? Because it doesn't affect me. So what finally brought them to that change was the story of their elder cousin who with their uncle who died, and in the city of Chicago lost his body. They were supposed to do an autopsy because he died of COVID. The autopsy was never done. His body was lost for 3 freaking weeks. And it wasn't until that we put some pressure on the place that last had the body that we were going to file a lawsuit, even when reported to the police department that y'all done lost my daddy's body. And they said, well, that's not a crime. So it wasn't until I told my millennial cousins, because they were like, cuz Chris, when are you going to have a funeral, for Uncle Joe? And I says, I can't. I don't know where his body is. And that's when they started, what? So they started hearing the stories of what was going on just with their own cousin, that they decided, oh man, I really need to do something here. And what if we lose her? Do we have to worry about the city of Chicago losing our cousin's body too? What else are they going to lose? So you got to get those stories out amongst the people and amongst millennials, because yes, they have disengaged, and they're not going to engage until they hear the personal stories of the reasons why we need more vaccines, we need more access to health coverage, we need more help in our public schools.
Yes, I agree. I just added in the chat that the only thing that combats the apathy is to build empathy.
I saw that.
And that we might benefit from, along with pushing the ordinance forward, benefit from a storytelling campaign that kind of hits some of those target demographics, like finding people in the demographics that have been hardest to reach, young people, people from, underrepresented communities, finding people where they would have a shared experience with, because it's one thing when it's happening to a bunch of people that you don't know. It's another thing when, oh, this is such and such's cousin who's on this video talking about how COVID-19 has impacted them, and how not having access to the vaccine, how that has trickled into, their lives. I think that having something with that, with the ordinance, as we're building some traction around it, might help.
One
I'm happy to support that.
One suggestion I have, I work very closely with the Hyde Park Art Center, which has free art programs to teenagers. Free. And one of the things that we've been suggesting is to have some of the teenagers, Kenwood High School being and Hyde Park High School being the closest to there, that they are looking into doing some projects of teenagers telling their stories during the pandemic. And they're looking to do a documentary, about what their experiences are. And let me tell you, if some teenagers did something like that, this 67-year-old would more than willing to look at that too. And that's how we build empathy, by letting people start to tell their stories. So, and I have a perfect example of that myself. I started because I didn't have access to the Hyde Park Art Center because it was closed during the pandemic. Lo and behold, an art gallery picked up my series of drawings, and it's in I ain't never been to Washington State, but my artwork has been to Washington State talking about this exact experience. And so I'm more than willing that if we want to talk to the heads at Hyde Park Art Center, I have their ear. And that's one way of getting a concerted project together where people start to tell their stories. And then the other thing is doing something through WBEZ, their storytelling hour. That someone needs to contact them and say, when is your next storytelling hour going to happen in Chicago? Can we get some people to do that? And Channel 2 News has been very, very good, more so than the other channels, has been very good at telling stories of things happening to people in the Chicago area.
Thanks, Chris. Apologies to Jesus and apologies to Rose. She trusted me with being the moderator, and she probably will have tons of notes for me later on what I should have done. So, please go ahead. Thanks.
I was just saying to Tiana that, social media, I made the mistake of sending one of my millennial coworkers a speech in text, and he replied saying, "Hey, so I'm a millennial, I'm not going to read it." And I was like, really? But I guess any tools we have, YouTube, Twitter, to reach people. And I try to post something every day about COVID, hoping to reach people. And it does, because my following is growing. But what concerns me too now is that I teach for the city colleges, and I have colleagues that are 50 and over, and they are refusing to booster, saying they've had it. And I'm like, my appeal was, please, for the love of God, I don't want you to die. The booster lasts maybe 6 months. The science isn't clear. Why wouldn't you want a booster? These are chemists, biologists. These are highly educated people that are fed up. Yeah, right. So I think we have to educate everybody we can,
Barbara, I see your hands up. I'm sorry.
Yeah, I was thinking about it, everything you were saying, and I was thinking, again, I just kind of thinking, we have such limited resources. And I'm in several groups and organizations, and many of us who on this call right now are on some of the same organizations. So you're spread so thin. And I was thinking of what Howard was saying about his area has one of the largest, highest mortality or morbidity rate in the country. If we can just take, maybe collectively, we organize, and like, I think your alder person has been very supportive of the ordinance. If we can mobilize in one specific area, take all of our talent and resources, work with that alderman, their staff people, the organizations in that community, the schools, the club, or whatever, and set it up as a model that we can then demonstrate and replicate in other areas. And it could also help, because now the older persons of those communities, with all this extra money that's coming in now with COVID, can also write a grant for the community to help the young people in those communities to get jobs and training. And when we're talking about the brigades, when we're talking about the young, well, don't have to be young people, just members of the community, those who may be interested in healthcare may want to start off as a nurse assistant, or health educator. Put in so many hours, we can also develop a curriculum where they can get certified, get some credentials, and that they can then move up the ladder as they choose. So I'm just thinking, how can we use all of our resources? Because we're spread so thin, and we're not going to get, we can't mob. It's like the military. You only have so much to work with. How do you make the greatest impact to save the greatest number of people? So kind of using that philosophy, and then move on, or maybe 2 or 3, that communities awards we can look at like that.
Howard, I see your hands up.
Maybe we need to narrow it down to 1 minute or 2. Joy.
So, yeah, I would really just second what Tarina said, and I think that we would love in People's Response Network. So we, including, of course, Barbara, Jesus, Joy, Lauren is here, to work with you around this issue, way of telling stories. I'm sorry, like Barbara can give 100 PowerPoint slides with statistics. One story is more powerful than any statistic.
It is.
Now they're complementary, but it's really powerful. So I would be happy myself. We also have somebody who isn't here tonight named Courtney. She's a mother of 3 CPS kids, and she actually tried to start a video project of telling stories. And she's got videos of her 6, 7, 8-year-old kids telling stories about why they got vaccinated. So I think that's a great idea, and we would love to work with you on that. The only other thing I want to just show people that's in the chat is this idea of, we didn't include stories, but what else, what else can you do? So we have these are in the chat. They're very specific. We have a petition you can sign online. You can hand out a flyer that we have anywhere. You can like our Facebook. So I'll just go down the line. We have some inside emails for the mayor. Manuel Perez is the head of Mayor Lightfoot's intergovernmental affairs. So that's very important for the ordinance. You can join our meetings every week. And last but not least, we have worked with community organizations in Little Village, Pilsen, Uptown, other neighborhoods to organize about 10, actually it's now going to be 12 COVID vaccine and testing events in the last year and a half. So if you, your neighborhood, your organization, whether it's West Side, South Side, would like any help of organizing these events, Barbara and I and one of our sisters who's transitioned named Charlene Fry was the actual guru of organizing these events. We've done hundreds of them in the last 50 years, so we'd be happy to work with you to do that. If you're looking for somebody to vaccinate until the Congress gets around with their own time of passing this bill, we are put a lot of pressure on Walgreens, who've only made $6 billion off of vaccinating with our tax money. So that's who's going to be doing our event in Little Village, but these events are open to everyone. The next one is Juarez High School at Ashland and Cermak. Anybody can go there, any age group 5 and above. So if you're interested in that, please send people there. Otherwise, we're happy to work with you to get one in your own neighborhood.
Or did I hear right? Did you say Walgreens was doing the event at this place? Is that?
Yeah, Walgreens. So we've actually worked with Walgreens because we can't get the city to come out. We can't.
I know.
Yeah,
But when they do that, they don't charge the people for the vaccines.
Nope. Oh no, not at all.
Oh,
Nope. No charge. Nobody. And the other thing is our events, no IDs, no insurance, no documentation, no appointments. You just do it the old fashioned way. You walk up and get your shot.
Thanks, Howard. I'm gonna show on my own screen. See if I can do this. This was the petition that I put in the chat, and we're asking people to call and email their alder people, and it has the sample script that's in the chat, and the petition is also in the chat for people to sign, because we need to put pressure on them and say, hey, sign this thing.
Excellent.
Thank you. I'll stop sharing now. There. Oops. Okay. Thanks so much for hanging in there. We ran longer than we originally planned. Rose, what do I do now? What do you advise? Take it from here or help? Do we just?
Actually, if people have questions.
I really just want to thank everybody who participated in this event. I thought it was very, very informative, and hopefully we can get I can get email copies of the slides that you did if you haven't already sent that over. And I apologize to Tyrena for not saying anything about representing Westside N.A.A.C.P, but I'm saying it now, and thank you very much. And again, Jesu, who helped us set up our YouTube account, and at our next event, we probably will be using the YouTube. And Howard and Barbara, wonderful presentation. So, Christine and Isaac, is Isaac still on the line? Our chair.
He left.
Okay, was with us earlier, and he did say that he had another event. I hope I didn't miss anyone, but again, I'm going to repeat what has already been said, that the storytelling campaign, I think, is a wonderful idea. And the other thing is that, Tyrena, if you have anything that you would like to say or talk about what the Westside N.A.A.C.P is doing as it relates to COVID-19, I'm giving you the floor, and then Joy, we can close it out. Thank you.
Thank you.
Good job.
We recently, this is Tarina. The only thing I wanted to just say that we recently supported, the Atlanta branch actually came to the city of Chicago and partnered with a few Westside social service organizations, N.A.A.C.P Services Corporation, and in collaboration with our branch and Danny K. Davis to get COVID-19 vaccine, to, support vaccine efforts as well. So we've been doing a lot of partnering because from our perspective, collaboration with other community organizations is the only way to really move the needle, and not trying to, independently, reinvent the wheel. And so we'll continue to support and contribute to the efforts that are happening around the city. And I'd love to continue to support you guys. I'm really excited that we're able to work together on this.
Okay, thank you. The other thing, Howard, I see in the chat you're asking for slides or the chat. What is it that you need, Howard?
I got it, Rose. I saved the chat for anybody who needs it.
All right. Okay. Thank you.
Welcome.
Yeah, if I could just say one thing, I would really encourage everyone, if you have not had a chance, to read about what happened on Monday, 3 days ago, when the most dire, significant report from the United Nations Intergovernmental Panel on Climate Change came out. We are going to circulate in the People's Response Network and to everyone a video that was simultaneously broadcast around the world on public PBS in the United States, because this is the biggest elephant in the room. You know, it's directly related to this pandemic because it's been the destruction of the environment, particularly in Africa, Asia, and Latin America, that has led to Ebola, it has led to this pandemic and everything else. But, you know, we are 3 months away from July. And basically 27 years ago, we had the worst heat wave in the history of the United States that killed 739 people. So we are going to continue to look to work with all of you, you know, as partners, because this comes down to what we did with Fred Hampton and the Panthers, and that is literally community survival. We really have to see this as a block by block, door by door thing of what we're going to do when the electricity goes out and it's 110 degrees outside and there's no water to drink.
Wow.
That's what we're looking at, maybe this summer and certainly soon. The UN gives us about 2 to 3 years to literally change the whole direction of carbon in the ground. This is one step. I think this is a fantastic meeting. We look forward to working certainly with Rose, because Rose and I met working on environmental justice in 2010, I think. And it's great to meet Tarina and everybody else. So thank you so much.
Okay. All right. I'm going to say good night and stay tuned for our next forum on COVID-19. Thank you.
Thank you.
Thank
Thanks,
you.
everybody.
Thanks, folks.
Thanks,
Bye.
everybody.
Bye.
I'm on a mission to free all of the people. I got a vision of peace on earth. My decision to shape reality will be in my every act and word.